Have you been feeling unusually tired lately, even after a full night's sleep? Maybe you've noticed your energy isn't what it used to be. You walk into a room and forget why you're there. Your legs feel strangely weak when climbing stairs. Or there's a tingling sensation in your hands and feet that you just can't explain. Many men over 50 assume these changes are simply part of getting older. They blame stress, poor sleep, or the natural aging process. But what if I told you that in many cases, these symptoms are not just getting older? They could be your body quietly signaling a hidden nutrient deficiency that millions of people overlook every day. Vitamin B12 deficiency is far more common than most people realize, especially after the age of 50. And the tricky part is that the symptoms often appear slowly. At first, it may just be fatigue, then brain fog, maybe mood changes, memory slips, or balance problems. Because these signs build gradually, many people ignore them or assume they're unrelated. But inside the body, something important may already be happening. Vitamin B12 plays a critical role in keeping your nerves healthy, supporting your brain, producing red blood cells, and helping your body maintain energy levels. Without enough of it, your body simply cannot function at its best. Over time, a deficiency can affect your energy, your thinking, your mood, and even your heart and nervous system. And for men who want to stay sharp, active, and independent well into their later years, this is something you absolutely want to understand. The good news is that once you recognize the signs and understand the cause, vitamin B12 deficiency is often very manageable and sometimes surprisingly easy to correct. In this video, we're going to break it down in simple terms. We'll talk about the warning signs your body may already be giving you, why B12 deficiency becomes more common as we age, and what you can do to restore healthy levels safely and effectively. Because ignoring these early signals can allow the problem to grow quietly in the background. And the sooner you recognize it, the easier it is to protect your energy, your brain, and your long-term health. To understand why vitamin B12 deficiency can have such a powerful effect on your body, we first need to understand what this vitamin actually does behind the scenes. Think of vitamin B12 as a kind of maintenance manager for some of the most important systems in your body. It helps your body produce healthy red blood cells, supports your nervous system, and plays a major role in how your brain processes information. Without enough B12, these systems start to slow down or malfunction. One of the main jobs of vitamin B12 is helping your body create red blood cells. These cells carry oxygen through your bloodstream to every organ, muscle, and tissue. When B12 levels drop too low, your body may start producing red blood cells that are larger than normal and less efficient at carrying oxygen. This condition is called megaloblastic anemia. When this happens, your body essentially runs on a lower oxygen supply, which can leave you feeling constantly tired, weak, or short of breath even during simple activities. Vitamin B12 also plays a key role in maintaining the protective coating around your nerves. This coating, often compared to insulation around electrical wires, allows signals to travel quickly and smoothly between your brain and the rest of your body. When B12 levels fall too low, that protective layer can begin to break down. As a result, communication between your brain and your muscles or senses may become disrupted. This is why people with B12 deficiency sometimes experience numbness, tingling, balance problems, or unusual sensations in their hands and feet. But the story doesn't stop there. Vitamin B12 is also deeply connected to brain health. It helps regulate certain brain chemicals that influence mood, memory, and focus. When levels drop, some people begin experiencing brain fog, forgetfulness, irritability, or even symptoms that resemble depression. Over time, if the deficiency becomes severe, it can even contribute to nerve damage. So why does this problem become more common after the age of 50? The answer has less to do with diet and more to do with how the body absorbs B12. Vitamin B12 from food needs stomach acid and a special protein called intrinsic factor to be absorbed properly. As we age, stomach acid production often declines, making it harder for the body to extract B12 from foods like meat, eggs, and dairy. Certain medications, digestive conditions, and even long-term stress can make this problem worse. Over time, B12 levels can quietly decline without obvious warning until symptoms begin to appear. Understanding this why is important, because once you know the underlying cause, the next step becomes much clearer. How to restore healthy B12 levels and support your body the right way. Now that you understand why vitamin B12 matters so much and why deficiency becomes more common with age, the next question is obvious. How do you fix it? The good news is that restoring healthy B12 levels is often straightforward once you know the right steps. The goal isn't just to increase the number on a lab report. The real goal is to help your body absorb and actually use this vitamin so your energy, brain function, and nerve health can improve. The first place to start is with the foods that naturally contain vitamin B12. Unlike many vitamins that come from plants, B12 is primarily found in animal-based foods. Your body evolved to get it from sources like beef, fish, eggs, poultry, and dairy products. For many men, simply improving the quality and consistency of these foods in their diet can make a noticeable difference. For example, foods like salmon, sardines, lean beef, liver, eggs, and yogurt are some of the richest natural sources. Just a single serving of salmon or beef can deliver a large portion of the daily B12 requirement. Eggs are another excellent option because they're easy to prepare and fit into many meals. Even a simple breakfast with eggs and yogurt can help support better B12 intake. However, here's the important detail many people miss. Eating foods with B12 does not always guarantee that your body will absorb it efficiently, especially after age 50. Remember what we talked about earlier, the stomach needs enough acid and intrinsic factor to pull B12 out of food and move it into the bloodstream. If stomach acid levels have declined with age, absorption may not be as strong as it once was. This is where supplements can become very helpful. Many doctors recommend B12 supplements for adults over 50 because they are easier for the body to absorb than B12 trapped inside whole foods. One of the most common forms is cyanocobalamin, while another form called methylcobalamin is often used in nerve support supplements. These supplements are available in several forms. Some come as tablets you swallow, while others are sublingual tablets that dissolve under the tongue. The idea behind sublingual B12 is that some of the vitamin can enter the bloodstream directly through the tissues in the mouth, bypassing part of the digestive process. For people with weaker stomach absorption, this can be especially helpful. Another option, usually recommended when deficiency is more severe, is vitamin B12 injections. Injections deliver B12 directly into the bloodstream, which completely bypasses digestion. Doctors sometimes use this approach when someone has very low B12 levels or conditions that prevent proper absorption. The injections are usually given weekly at first and then spaced out once levels improve. But supplements alone are not the full story. There are also a few simple habits that can support your body's ability to maintain healthy B12 levels over time. One important habit is paying attention to digestive health. A healthy stomach environment helps the body extract nutrients more efficiently. Eating slowly, chewing food thoroughly, and avoiding constant overeating can support better digestion. Another helpful strategy is maintaining balanced nutrition overall. B vitamins often work together, so nutrients like folate, iron, and vitamin B6 also contribute to healthy blood cells and energy production. When the body receives a balanced mix of nutrients, it can use B12 more effectively. Timing can also matter more than people realize. Many individuals find that taking a B12 supplement in the morning works best because it supports natural energy production throughout the day. Since B12 helps the body produce energy at the cellular level, some people report feeling more alert and mentally clear when they take it earlier rather than at night. Hydration and movement also play a role. Regular physical activity helps improve circulation, allowing oxygen and nutrients to move efficiently through the body. Even something simple like a brisk daily walk can help your body use nutrients more effectively and support overall vitality. The key message here is that improving B12 levels isn't about one single magic pill. It's about giving your body the right building blocks, making sure those nutrients are absorbed, and supporting your system with healthy daily habits. When these pieces come together, many people notice improvements in energy, mental clarity, and nerve health over time. But there is something important you should know before rushing out to buy supplements or drastically changing your routine. Many people unknowingly make a few common mistakes that can cancel out the benefits of B12 or even hide the real problem. When people first learn about vitamin B12 deficiency, many rush to fix the problem as quickly as possible. That's understandable. If you've been dealing with fatigue, brain fog, or tingling sensations, you naturally want relief fast. But this is where some common mistakes can quietly interfere with real progress. And surprisingly, these mistakes are very common among adults trying to improve their health on their own. The first mistake is assuming that simply taking a random supplement will solve everything. Many people walk into a pharmacy, grab the first vitamin B12 bottle they see, and expect immediate results. But the truth is, not all deficiencies are the same. Some people have mild dietary shortages, while others struggle with absorption issues in the stomach or intestines. If absorption is the real problem, swallowing a standard tablet may not be enough to fully restore healthy levels. This is why some people take supplements for months and still feel no improvement. Another mistake is ignoring the underlying cause of the deficiency. Vitamin B12 levels can drop for several reasons. Reduced stomach acid with age is one factor, but certain medications can also play a role. Long-term use of acid-reducing medications, for example, can make it harder for the body to extract B12 from food. Some digestive conditions can interfere with absorption as well. If these root causes aren't addressed, the deficiency can quietly return even after treatment. A third mistake is brushing off the symptoms as normal aging. Many men over 50 assume that fatigue, memory slips, or balance problems are simply part of getting older. But while aging does bring changes, persistent symptoms should never be ignored. In some cases, untreated B12 deficiency can slowly affect nerve health. Over time, nerve damage may become harder to reverse if the deficiency continues for too long. That's why recognizing the signs early is so important. Another common problem is inconsistent supplementation. Some people take vitamins for a week or two and then stop once they feel slightly better. But restoring B12 levels often takes time. Your body needs consistent support to rebuild healthy red blood cells and restore proper nerve function. Stopping too soon may allow levels to drop again before the body fully recovers. There's also an important safety consideration to keep in mind. While vitamin B12 is generally considered safe, it's still wise to discuss supplementation with a healthcare professional, especially if you have existing medical conditions or take prescription medications. A simple blood test can confirm whether your levels are truly low and help determine the best treatment approach. The bottom line is this: correcting a B12 deficiency isn't just about taking a supplement. It's about understanding your body, identifying the real cause, and supporting your health consistently over time. Avoiding these mistakes can make the difference between temporary improvement and long-term results. So let's quickly bring everything together. Vitamin B12 may be a small nutrient, but its impact on your body is enormous. It supports your brain, your nerves, your red blood cells, and the energy systems that keep you active every day. When levels begin to drop, the body often sends quiet warning signs. Persistent fatigue, brain fog, memory slips, tingling in the hands or feet, and even balance problems can all be signals that something deeper is happening beneath the surface. For many men over the age of 50, the problem isn't necessarily a lack of B12 in food. The real issue is absorption. As we age, stomach acid levels often decline, and that makes it harder for the body to extract B12 from foods like meat, eggs, and dairy. Over time, this gradual decline can lead to symptoms that affect energy, focus, and overall vitality. The encouraging news is that once the problem is recognized, it's often very manageable. Improving B12 intake through nutrient-rich foods, using the right type of supplements when necessary, and supporting digestive health can all help restore healthy levels. Consistency is key, and understanding the real cause behind the deficiency makes the solution far more effective. But awareness is the first step. Many people live with low B12 levels for years without realizing what their body is trying to tell them. That's why paying attention to these early signals can make a powerful difference for your long-term health, energy, and independence as you age. Now here's a simple challenge for you. Over the next few days, pay attention to how your body feels. Think about your energy levels, your concentration, and whether you've experienced any of the symptoms we talked about today. If something feels familiar, it may be worth discussing with your doctor and checking your vitamin B12 levels. Sometimes a simple blood test can reveal what your body has been trying to say all along. And before you go, I'd love to hear from you. Have you ever had your B12 levels tested or experienced symptoms like fatigue or brain fog that later turned out to be a deficiency? Share your experience in the comments. Your story could help someone else recognize the same warning signs. If you found this video helpful, make sure to like the video, share it with someone who might benefit from it, and subscribe to the channel for more simple, science-based health insights designed especially for staying strong, sharp, and energized after 50. And don't forget to save this video so you can come back to it whenever you need a quick reminder of what your body might be trying to tell you.